Okay, so in this video, I'm going to teach you the Alexander technique, lie down. And this is really one of the cornerstones of the work and something that you really should consider incorporating into your day once or twice to lie down 5, 15, 20 minutes, hopefully at least once or twice a day, okay? So what I'm going to do is I'm going to show you how to get down onto the floor, and then I'm going to just talk you through how you should think about yourself while you're down there. I just want to point out that if you look on the web and you're kind of surfing around and looking at Alexander things, you may find people refer to this as constructive rest or semi-supine, but I like to call it the AT lie down. Okay? All right. So you're going to start by sitting on your bum like this with your knees bent and your feet flat on the floor. And remember, we always want to move from our AO joint. So you're going to allow your head to drop here. You're going to drop your chin towards your chest, and you're going to bring one knee towards your chest, and you're going to roll yourself down onto a pile of books, or here I'm just using little kneeling wedges, okay? And you're going to lie here with your feet flat on the floor, your knees pointing up, and your hands on your abdomen or your rib cage. Now, you may find that if you're here for a few minutes, you may find that you feel a little tightness in your lower back. And if that is the case, you want to roll your pelvis up and allow it to release down. Just do a little pelvic tilt. You also may find that your knees may shake, or you're feeling a lot of tightness in the legs. And if that is you, you can just lower one leg, but keep the other leg bent. Okay, so your hands are on your rib cage, your head is on the books, and you don't want the books to be too close to the neck. You want your books to just be at the occiput, that bony ridge at the back of the skull here. Okay, so don't let those books press against your neck. And if you find that it's difficult, some people, if you're a sensitive person, some people need to put a little, like a face cloth or a tea towel in between their head and the books. Sometimes even the paperback books are too soft, or too hard, I mean. So paperback books, not hardback books, a tea towel or a face cloth, and hands on your rib cage, and you're going to lie here. And you're going to think about yourself. And you're going to tell yourself to allow your head to release onto the books. And you're going to tell yourself not to clench your jaw and not to clench your tongue. And you're going to ask yourself to lighten up and let your neck go. And allow your upper back to release onto the floor. I should mention here that if you have difficulty getting down onto the floor, you can do this in your bed. But make sure you use books behind your head and not a pillow. So allow your upper back to release onto the floor, your shoulders, your ribs, your lower back, releasing onto the floor. That's it, allowing your sacrum to release onto the floor. And your feet. Allowing your elbows to release onto the floor, and your hands onto your abdomen. And I want you to think about yourself spaciously, thinking of allowing the shoulders to release away from each other, and your pelvis, the right side of the pelvis, to release away from the left, and the left from the right. And just think of yourself as if you're falling back onto the floor, trusting and knowing that the floor is releasing up and supporting you. And you're just going to lie here with your eyes open. You may listen to some music, but don't have a conversation. Don't talk on your cell phone. No watching TV. Right? This is time for you to think about yourself, to let go, to stop, to really, really stop. Really stop. Press that stop button and let go. And see where are you holding on? What is unnecessary? What is getting in your way? So you lie here. Hopefully 20 minutes. Once or twice a day. Good. So, one thing you can do is just set a pile of books and a mat or a blanket on the floor and just leave it there. And then you just know, it reminds you, oh, time for me to do my lie down. Good. So now we're going to get up off the floor. And the way we do that is we turn our eyes in one direction and let our head follow suit. Let our shoulders roll over and our knees. And now we're in a fetal position on the floor or in your bed. You're going to take this top hand and you're going to press it into the floor and bring yourself to a sitting position. And that's it. Thanks.